Hello, everyone, and thank you for joining us. My name is Ravina Kumar, and I'm an account manager here at Hixny. Today, we are pleased to welcome 3 providers from the Hixny community whose conversation will explore how the preventative measures being asked of us during the COVID-19 pandemic, things like quarantining and social distancing, are impacting their patient panels. With specialties across healthcare, including psychiatry, social work, and primary care, they will touch on many important points. Please join me in welcoming our panel, Dr. Colleen Quinn, Chief of Medical Education and Wellness at Hudson Headwaters Health Network, Jody Kovac, licensed clinical social worker. Jody is the Director of Community Services at Mohawk Opportunities. And Dr. Igor Epstein, board certified psychiatrist and founder of Trillium Psychiatry. Dr. Epstein also works at the Capital District Psychiatric Center. With that, I'd like to hand things off to my colleague and fellow account manager, Martha McGurk, who will act as our moderator today. Martha?
Thanks very much, Ravina. I'd like to thank the presenters as well for joining us and sharing their experiences and expertise today. COVID has impacted everyone. Regardless of whether we're in healthcare, it's an important topic, especially as an end is still unknown. Having experts in the field as partners offered us the opportunity to bring some of them together, discuss the effects the pandemic is having on people. So here we are. Each of our presenters today are going to provide some insight into their worlds and how the pandemic has impacted their patient populations in their different fields of healthcare. First up, I would like to introduce Dr. Colleen Quinn, Chief of Medical Wellness and Education here at Hudson Headwaters Health Network. Dr. Quinn has worked as a family physician in rural upstate New York for the last 20 years. She's dedicated to building healthy communities through the sustainment of small town healthcare. She'll be addressing some of the more practical concerns many of us have at this time, whether it's during this flu season, visiting doctors' offices, or children attending schools. She'll also be touching on the importance of self-care and how to recognize symptoms of decreased mental health at this time. Dr. Quinn?
Thank you, and thank you everyone for allowing me this opportunity to talk with you today. So as Martha said, I'm a family physician, and I'm hopeful to touch with you today on the mental health effects of COVID-19 from the primary care perspective. So the goals today of what I'd like to do is really try to recognize the emotional and physical symptoms produced by stress, understand the resources available through primary care, and how to access them, especially during these times. Be aware of the stress presentations in children and adolescents, and hopefully be able to discuss ways to stay safe as we go into the winter months and also the holiday season. So when you look at the year, this past year of 2020, it's really been one of uncertainty. And I think just to give a little bit of just background, just knowing a little bit about the role that all of us play. So, COVID-19 has not gone without affecting each of us. So I am a physician, but I'm also a mother of 2 adolescents. My husband is a school teacher and works in a local school district. I have parents out of state. And so we all are in these different roles in our lives right now. And we're all juggling ways that we need to be present for all of them. And COVID came to us as a novel virus, meaning we don't know very much about it. Over the last 8 months, we've gained a lot of knowledge, but in that process, science is not exact, and there's been different messages, and we've really dealt with a lot of uncertainties in the political realm around this as well. And so what this has meant is that what we do know is that wearing masks, and I'm going to use the word physical distancing versus social distancing are two important things involved in this. But what that's done is it's caused a lot of increased stress in our lives. So people have lost jobs through this. Schools have been canceled, so children are at home. Parents are now playing the role of school teacher as well as trying to navigate work environments. The loss of jobs has resulted in loss of health insurance. We're seeing increased health disparities in our local communities, a lot more food insecurity, so people not having adequate food supplies, and especially in children, if they're not in school, not being able to get free lunches and free breakfasts has been impactful. The lack of freedom that we have now has, something that can be done for short periods of time, but as we look at it for long periods of time, has really impacted our autonomy. And then take this into the political and cultural events that have been happening in the United States over the 8 months. It really increases a lot of stressors on us. And what stress does in our bodies is that it releases certain neurotransmitters and chemicals like increased cortisol, increased adrenaline that have distinct impacts on our lives. So in the short term, a stress response is necessary to survive things. So, biologically, if a bear attacks us and we get a stress response, we want to run. But when that stress response is ongoing, it causes chronic health implications. And so some of the things that we've been seeing in people increasing over the past 8 to 10 months are physical and emotional. And so the stress response physically can cause poor sleep. People can get chest pain or palpitations or even shortness of breath, gastrointestinal issues. We see increased pain syndromes and headaches, and even poor control of chronic conditions. As these cortisol levels rise, it can increase high blood pressure, it can increase diabetes and weight gain. Emotionally, this is tough. So people are feeling irritable or on edge. You may see in yourself or in others, more crying, even confusion. Poor concentration. Children, we see a lot more temper tantrums or clinging, and there's a lot of fear-based thinking that occurs with all of this. And so what we do with this is very impactful. And what we try to do as individuals is try to self-medicate in a sense, right? Try to make ourselves feel better. And there are ways of doing that that are helpful, but there are ways of doing that that can actually make things worse. And so I'm just going to go through these just so that you can see what we've been seeing, and also maybe see in your friends and colleagues as well. So substance use. So people tend to turn to things to make them feel better, like alcohol or other drugs like marijuana. And we've been seeing that increased use of those substances in our communities. We were starting to stabilize the opioid deaths before the pandemic, but we're now seeing an increase of overdoses associated with that. Some people self-medicate with food, and so increased eating disorders, whether it's overeating or even trying to control things by undereating. Aggressive behaviors can have a significant negative consequence as people are isolated in home and quarantined in home, and so we are seeing a rise in domestic violence and child abuse. People, because they're fearful, are avoiding going out and even to providers, but there's also a lack of trust in the healthcare system right now, and especially also feelings of shame around some of these uses of alcohol and other issues. People are sometimes even feeling more isolated because of that fear. And so they're socially isolating as well as physically isolating. And all of these things can lead to increased depression and anxiety. And so the reason why I wanted to go through this is so that you can see, and maybe people around you, when to try to reach out. And so the role that the primary care physician or provider plays in this is that we can really address the concerns around some of these things. So we can identify urgent issues. So I talked to you about some of the physical symptoms that can happen, but some of those clearly are related to serious medical problems. So chest chest pain can be related to heart problems. And we have seen, especially in New York City during the early parts of this pandemic, that people avoided accessing healthcare, and we saw an increased risk of preventable death from preventable conditions like strokes and heart attacks. We can help diagnose need for interventions, whether that's medical interventions or referrals to other places to help people get the support that they need. I think one of the big roles in primary care, especially as we look at people through a biopsychosocial model, is really work with them, empowering them in their own wellness. You know, I said to you in the beginning that, you know, COVID affects everybody, and we need to have some self-compassion for ourselves, because this is really hard. We're trying to juggle new roles as well as maintain old roles, and really being open about that and creating community with one another can be helpful. The fundamentals in wellness are trying to get enough sleep, exercise. Exercise is one of the best ways to decrease some of those cortisol and stress levels in your body in a healthy way, and eating well. And so sometimes it means looking at, in order to make time for those things, what can we put down that may not be so important right now. One of the things that I found to be very helpful is even taking short mindful breaks during the day. And these can be super easy. It's just a matter of, you know, taking a moment, even if you shut your eyes or open your eyes, just feeling your feet on the floor, and taking a deep breath in for like a count of 3 very slowly, and letting it out for a count of 5, and doing that 2 or 3 times. And that will naturally release some of those stressors on your nervous system. What I have been seeing is one of the biggest stressors for people right now, and especially, you know, I think it's going to continue on for the next few days in particular, is really overusing media, and that's social media, Facebook, Instagram, Snapchat, but also listening to pundits in the news. Really, I think it's important to find a news source to be able to review so that you're on top of things, but really try to stay away from some of the perseverating ideas that are happening now. We can, on that note, if we're talking to people and finding that people are really just struggling more, one of the things about Hudson Headwaters, and I know other organizations have too, is we have embedded behavioral health in our facility. So we can do warm handoffs to providers to help people learn tools to be able to take care of themselves a little bit better, and access to care managers to help with things like food insecurities or housing, and resource advocates that will allow for the ability to gain access to things like healthcare during this time when it's more difficult. So accessing healthcare is a big issue, right? I just talked to you that, you know, people are really fearful. There's just distrust in terms of going to the health centers right now. I think our area is a little bit better. The prevalence of COVID right now, knock on wood, is still in a decent level. But going into the winter months, I think that's going to change. And so one of the things that we do, and that I'm sure other places do, is that we really triage people. So we make sure that when people come in, if they're sick, they're seen in a very separate area than if they're well. And so that can help people feel more secure in coming into the office. I think one of the silver linings of COVID, if we can pick something, is the access that we now have to telehealth and Medicare's role in pushing that forward. And so we can do many more video visits with people, and this is in the primary care world as well as the mental health world and behavioral health world. And it has provided access to people to access these resources that because of work or other obligations would never have been able to before. We can also connect with people more with telephone calls. And one of the things that's unique to the virus is that it also causes innovation. And so, you know, we have a health system that runs all the way up to Canada and now Saranac Lake. And so we cover a pretty rural area where there is not access to cell phone service and Wi-Fi. And so to make access to the video visits easier, we've been able to provide Wi-Fi access outside in our parking lots, so people can drive there and then be able to see their providers. So I do think that innovation is important sometimes in what we're dealing with. One of the populations that I just want to make special mention of, this has come up from questions I receive from from parents, from colleagues, as well as people in the community, is that they're really concerned about their children. And this concern revolves around, the physical health of their children, and also the stressors around school. And so when we are stressed, and we're dealing with the adult things that we deal with, kids pick up on that, and they often internalize that and feel that they're doing something wrong, or they're the ones to blame for our anxiety. And so it's really important to talk to kids in non-scary terms about things that are going on in the world and in your life to their appropriate level. And one of the ways of doing that is to ask questions. So for young children to say, how was school today? Or what's it like wearing a mask? And just listen to them respond. So it's this ask, respond, and then talk about it. Then tell them things that you want them to know in terminology that they can appreciate. I think that for children, modeling behavior is really important. So wearing masks yourselves, talking to them about physically distancing from other people, giving them empowerment to take care of themselves. So equipping them with hand sanitizer to use at school so they don't have to rely on washing their hands if they can't have access to that. Talking to them, especially on the bus, about not sharing food and drink, and watch for signs of anxiety. So kids will have mood changes, sometimes sleep disturbances, eating changes. Everyone knows their kids. And so just be mindful of when you start seeing things like that, that maybe it's time to just sit down in a quiet place and try to have the start of a conversation. Teenagers, I'm going to throw young adults into this, college age kids, they're really struggling with this. They're a very social group. And so we're asking them not to do that. But they're also very willing to talk. And so even if you open the conversation and you don't get any response, they know that you're there, and they know that they can come to you if needed. Teenagers tend to isolate in their rooms, but not all of that is healthy. And so just really checking in with them to make sure that they're okay is important. So as we walk through or look through to the future, and especially as we're going into the winter months, what can we do to stay well? Where is the data? Really, masks are super important. So the more we're learning about COVID, the more we know and believe that it's aerosolized, which means that, the particles are in the air longer than we thought. So especially around talking and singing and yelling. So wearing those masks is super important. Hand washing, so that's 20 seconds with soap and water. That's 2 happy birthdays for kids, or using hand sanitizer with at least 60% alcohol content in it, maintaining physical distance as best as our abilities, and staying on top of state guidelines. New York State does a pretty decent job of giving us information, and that can be accessed through the Department of Health. I'm a very firm believer in the flu vaccine on a good year, but this year in particular, I feel it's incredibly important. Normally, the flu kills 36,000 Americans every year. And so adding the flu and COVID on top of one another this winter season could be really devastating to our community. Anyone can get the flu shot over age 6 months. And so please, I can't emphasize the importance of that. Please stay home if you're ill. One of the things that helps spread things is going to work sick or being in places with others when you're sick. And choose activities wisely. So holidays are coming. This is going to be really tough. There's that balance of bringing people together who are isolated, older people, but really trying to be innovative and creative about ways of doing that physically distanced. Brown University Medical School put out an app called mycovidrisk.app, which allows you to put in your zip code. And so it takes into account the prevalence of COVID in your community. And you can put in the type of activities you want to do, and it will help you make them safer. And it will tell you what is safe and what is not safe. And so it's something to maybe consider as you're looking to plan activities throughout the winter months. I think the most important thing is to really practice self-care. This is definitely one of those times that we're going through that we really need to put on our own oxygen masks before we can help others. Be mindful and aware of what's happening within yourself, but also what's happening in your family, in your community, and know that it's okay to ask for help. We are all in this together, and it's really important to go forward as a community. So thank you very much.
Thank you very much, Dr. Quinn. Lots of valuable information for all of us on this call. Our next presenter is Jody Kovac. Jody is the Director of Community Services at Mohawk Opportunities. She's a licensed clinical social worker, serving adults with mental illness for the last 20 years. She's dedicated to building out relationships to facilitate growth and recovery. She'll be talking about some of the concerns facing our families and communities who are already vulnerable. Jody? Jody, I believe you are muted.
Sorry, can you hear me now?
Yes, thank you.
I am Jody Kovac, as Martha mentioned. I am appreciative of being invited to be part of this panel. Today I'm going to talk a little bit about the programs that we offer and how we have worked with our population who are already marginalized and vulnerable, dealing with life with COVID. So one of our teams is the Assertive Community Treatment Team, that is the ACT team. They are an OMH licensed evidence-based practice using the harm reduction model. And we serve 48 individuals living with psychotic disorders in the community. It's a multidisciplinary team, and services are generally provided in the person's natural environment. The other program that I also oversee is our Health Home Care Coordination Program, and that program primarily serves individuals with severe mental illness. Mohawk Opportunities also has various levels of housing for people living in the community with various mental illness. Just kind of as a broad overview, we know that about 1 in 6 individuals in the community will have some form of a mental health crisis throughout their lifetime. The population that I'm talking about today is people with severe mental illness, meaning they have a psychiatric disorder that has been diagnosed but has truly impacted their lives. That's kind of the severe part. So frequently they can't stay housed, their relationships are poor. Most of these people are unable to keep full-time work, and so therefore they're living on government benefits. And then I'm talking more about the subpopulation of people with psychotic disorders. I think it's important in the context of understanding these individuals and these individuals within the context of COVID, is to understand that they live on about $870 a month, far below the poverty level. So these individuals are already challenged with paying for housing, paying for utilities, paying for a telephone, hopefully being able to afford food for themselves. Rarely do they have money for special activities or fun activities. They are frequently kind of on a day-to-day basis trying to figure out where to put their money so they are most cared for. So then you throw on top of that the COVID crisis of not only do they not have enough money for toilet paper and hand sanitizer and masks, but now we can't even get that for them. So just some information, signs and symptoms of psychosis in the people that we serve. Frequently there are individuals who might hear voices, and they're not usually like happy, yay, go you voices. The voices tend to be more intrusive. Many times it's voices telling people that they're no good or they'll never amount to anything. It could be voices telling people that, you know, others are out to get them. Don't trust anybody. They also tend to have periods of paranoia and delusion. So they might believe things that aren't real. They might already believe that they have health issues that are going to harm them. They might already believe that no one cares about them or wants to help them. They might already believe that if they go outside, they're going to be in trouble. They might already believe that going to the doctor is something that's scary or difficult. So in trying to help understand and talk about how this is impacting clients, I thought I would give you a few vignettes, and then after that talk about how Mohawk as an agency has adapted, how the community has adapted, and the things I've learned about the best way to talk with individuals with mental illness and psychotic disorders. So the first person I wanted to tell you about, we'll call her Peggy. She's 50 years old. severe psychosis throughout most of her adult life. In addition to schizophrenia, Peggy also has respiratory issues, diabetes, hypertension, and on top of it, a deteriorated hip. Peggy likes to do things like walk in the community, hang out with friends, talk to her sister. These are all things that help to bring her comfort, and things that also she was not always able to do once COVID hit. Peggy, probably, I think in April-ish, developed an infection in her hip and a severe respiratory disorder, infection. She wound up in the hospital. Eventually, she was on a ventilator. While she was never tested positive for COVID, she was severely ill, and eventually she was taken off of life support, and she passed. She passed, fortunately, not alone. We were able to have one of our nurses go in and sit with her during that time. But it was a very sad ending to somebody who had a very hopeful life. Just to kind of sum up a couple of other people. We have two clients that we had served in the past who no longer were with us. They're both in their 30s. They know each other. When they came back to us, they were really well below baseline. One of them truly believed that he created the virus, and so therefore he didn't have to follow any safety protocols. He was immune. The other one also believed that he was immune to the virus. So trying to help them stabilize enough to be able to be willing to wear masks, because, you know, why should they wear them? And to maintain their distance from people and to stop hanging out in the community took a lot of work. Eventually, fortunately, they came around with the support of the team. They were able to get back on some medications, work with the team on some rehabilitative techniques, and eventually, with enough support and caring, they started to wear their masks and wear them properly, which is a whole other conversation. You know, they would have to use hand sanitizer when they came to our office. We've kind of modeled the behaviors that they needed to have. And for one of them, he got stable housing. He was no longer roaming the communities constantly. It's also important to mention, which I left out, that much of this population has co-occurring substance use disorders, metabolic syndromes, and all sorts of other health problems that can further impact their ability to function in the community. So that's just a couple of other of the individuals that we've served. Another particular client that as an agency we have served for probably a decade, if not longer. This individual, in addition to schizophrenia, PTSD, various other psychiatric issues, also has severe respiratory issues, pancreatitis, and aneurysm. I'm sure I'm missing a bunch of other of his physical health issues. Hypertension, high cholesterol, kind of the whole gamut of what we generally see. This person has functioned mostly in the community because of his friends, because of his girlfriends, and because of the support that he gets from the agencies that serve him in the community. He's somebody who's paranoid at baseline, who cognitively doesn't always understand. His thoughts get distorted. What we say to him sometimes gets distorted in his mind, and so what he hears on the other end is very different. COVID has been especially challenging for him. He tends to yell and scream at people when he is angry or upset or doesn't understand. So we've spent a lot of time over the last several months being yelled and screamed at. But using our harm reduction approach, we really are here to serve people, to walk with them on their journey, and to support them even when they're really angry, which sometimes happens a lot more frequently. This individual was very, very afraid of catching COVID, and given his vulnerabilities and his marginalized lifestyle, we really needed to step up and provide services for him over and above what we normally did. So we had to educate him about not going out into the community, about staying home as much as possible. We needed to deliver medications to him. Sometimes we needed to pick up groceries and bring it to his house because we really didn't want him going out and about. He did, however, go out and about and wound up in a situation where he thought he was exposed. And so that increased his paranoia, his stress, his anxiety. And we had to work with him on where to get tested, how to get tested. He was finally able to go get tested, but he could not tolerate his nose being swabbed. So he was actually handed the swab for him to swab himself because that was the only way he was going to be able to get tested. And so these are some of the things that we're really seeing with people who are already challenged and helping them navigate this new world that they're living in. I should mention that we use Hixny frequently. While it's not necessarily a large population of people that we serve, the people who hit the ED, like the other two clients that I was speaking about, we can tell when they've been tested. We at least know that they've had a test. We know what the results are. And this has been a really helpful tool for us because the people that we serve don't always tell us exactly what's going on in their lives. So just to speak a little bit about the agency and how we've had to change to serve these individuals. So of course, we're looking at the health and safety of our staff, as well as the health and safety of the people that we serve. We really decreased our face-to-face visits and decreased the time and frequency of those visits. We've moved to telehealth for people that are able to be served with it. But in order to do that, we needed to purchase cell phones. We needed to purchase monthly minutes because many of these people are so marginalized, they don't have those tools to connect. Video conferencing was pretty much out of the question. We maintained frequent contact. We provided lots of education about the benefits of wearing masks, how to wear masks, hand sanitizing, keeping distance from people. And that's one of the things that had been most complicated, I think, for people, is that many of them already felt socially isolated. They felt, you know, on the outskirts of society because of the lifestyles that they lived and what they're experiencing. So kind of recommending further isolation was really a complicating factor. And so allowing them to have phones to be able to reach out to friends and family and service providers was really important. We definitely saw a higher incidence of symptoms. People became more symptomatic during this time because of the anxiety and the stress, and that's something that we had to work with them through, just as the rest of us had increased, you know, anxiety and stress, but many of us have far better skills to deal with that and a far better social network to support us. So other things that our agency had to do, we had to facilitate appointments with specialty providers. Some of these individuals not only needed treatment for their mental health, but serious enough conditions to need treatment with their specialty providers as well. We provided masks for people when they couldn't afford it. We always carried them with us so that we had them for people. Frequently we had to purchase and deliver food because we didn't want people going out. And we had to remain aware of the services in the community. So many of these people got their meals through the city mission, you know, in the evenings they got dinner. Some of them were fortunate enough to go to Bethesda House in the afternoon and get a lunch. Almost everyone utilized food pantries as well. So trying to stay on top of those services and help them navigate during times when communal meals were no longer happening. As a community, we have made adjustments in terms of OMH lightening some of the restrictions around testing for medications. We all, I think, jumped onto Zoom and GoToMeeting in order to communicate better with each other and maintain our contacts. And so those are some of the things that we did as a community. What I've learned about how to talk to individuals with severe mental illness and psychosis about COVID over time was kind of trial and error. But I think the most important thing that we learned is to talk to these individuals in their own language, using clinical information or lots of stats or being directive doesn't always work. But to really speak to them in terms that they can understand and really allow them to ask questions, give them time, no questions too big or too small, and helping them to kind of make sense of the world that the rest of us are still struggling with. really normalizing it. I think, you know, as Dr. Quinn said, we're all going through this together, and being able to explain that to people and share in some of their anxiety. Lots and lots of mass education over and over and over again. And really, I think also educating them about the fact that science is ever changing. And so what we're sharing with them today, what we're recommending for them today may look very different in a week, a month, or 6 months. So I think those are some of the things that I've learned through the pandemic, and have learned about our clients that we serve in the pandemic as well. So thank you.
Martha, you're muted.
Hello. Forgive me for that. I'd like to thank you, Jody, once again. Important things to keep in mind as we all work to keep one another well. I'd like to transition next to Dr. Igor Epstein from Trillium Psychiatry and Capital District Psychiatric Center. Dr. Epstein is board certified psychiatrist. His approach to mental illness is holistic. He considers the biological, psychological, social, and spiritual aspects with each individual. He'll be expanding a bit more on mental health and how to address the magnified concerns. Dr. Epstein, if I may, psychologically speaking, how is the pandemic affecting people in general? And perhaps you could touch on how it may be especially impacting those with mental illness.
Martha, thank you for kind introduction. I'm very happy to be here. So we've been through a number of serious infectious outbreaks and pandemics in the 21st century. SARS, H1N1 swine flu, Ebola, Zika. But this one is probably the most deadly and consequential, the current one. We deal with chaos, uncertainty, fear of death, loss of income and housing, and all that prolonged stress, as explained before, exacts a psychological toll. Although most people actually respond to trauma with resilience, some individuals experience persistent mental health challenges. Resilience is not innate and fixed. It must be deliberately built. So choosing the attitude of post-traumatic growth over the victim narrative is a very helpful stance psychologically. Adverse psychological impacts have expectable, rather normal reactions associated, such as stress-induced anxiety, insomnia. But in addition, the new onset psychiatric illness or exacerbation of the existing ones may emerge. As disillusionment and demoralization appear in the wake of the acute phase, suicide prevention becomes an important goal. Martha?
In your experience, doctor, are patients who have more significant mental health issues experiencing magnified symptoms?
Yes, we see higher acuity among long-term patients, even the stable ones. We continue to provide the treatment, hoping to keep the illness stable, offer more frequent sessions. We do careful risk assessment with possible additional peer support, which is nowadays mostly remote. In some patients, grief or adjustment disorders should be considered. With prolonged stress and uncertainty, exacerbation of primary disorder happens. One interesting phenomenon amplified by this pandemic is the disconnect between the objective time measured by the clocks and calendars and the subjective time measured by our internal perceptions. Changed routines and working from home, uncertainty about the future contribute to the distorted experience of the passage of time. So essentially, trauma interrupts the normal flow of time and creates the perceptual distortions, such as confusion about the time, feeling like it stopped, everything is in slow motion, experiencing that sense of timelessness, or even confusing the order of time and days. Monday or Saturday feel kind of the same when you're at home all the time. Now, the saying that time flies when you're having fun is still subjectively true. So some of the common sense ways of trying to combat that time distortion is setting up regular schedule, which is essentially a social rhythm therapy, introducing some fun to our routine, or behavioral therapy. Now, some baseline and delusional people oftentimes turn to conspiracy theories about the pandemic, or they integrate the pandemic and the virus into their chronic psychotic worldview. So one task for the providers, as mentioned before, is sharing up-to-date information about the virus and promoting safety, hand washing, masks, distancing. While we do not want to overwhelm the patients with the data, knowledge gives people the sense of control. Demoralization and suicidal thinking need to be monitored. With relapse or increased alcohol use as a coping strategy, the clinical picture can be complicated. Last but not the least here, the smoking cessation. While it's a major treatment goal in general, it shall be still re-emphasized and not ignored during the pandemic. But to summarize, we do not see the tidal wave of new mental illness, but pandemic does exacerbate pre-existing conditions, and we expect to see a long tail of after effects from COVID-19. Martha?
Very interesting. Doctor, when a client is referred to you for help in dealing with stress and isolation caused by the preventative behaviors tied to this pandemic, are there underlying psychological conditions or concerns that you are finding more prevalent at this time?
Yes, virtually any person subjected to isolation or quarantine is at risk for psychiatric complications. And patients with severe mental illness, especially ones who live in the community residences or group homes, may be particularly susceptible to the new rules, masks, and no visitor policies. Many people with past history of trauma get more affected. People who've lived through pandemics or scares like that before. People with acute stress disorder or long-term post-traumatic stress disorder. Some people might not tolerate the PPE, the protective personal equipment, which might be causing claustrophobia, sweating, air hunger, panic. New onset adjustment disorder gets diagnosed a lot nowadays with significant distress and impairment, sometimes with symptoms of anxiety or depressed mood or disturbance of conduct associated. Symptoms of depression are very common, and especially in people with pre-existing major depressive disorder or less severe persistent depressive disorder or dysthymia. Seasonal affective disorder, while not a formal diagnosis in DSM-5, but rather a specifier of depression with seasonal pattern when there is temporal relationship of mood with time of the year. Those people might be more affected now with winter coming up, and it's a growing concern. Naturally, people with pre-existing anxiety disorders, separation anxiety in younger kids, generalized anxiety disorder in adults, they can get worse, especially with the breaking news bombarding us from the TV and social media, all those outlets. So it's important to limit that access and exposure. Agoraphobia and other phobias, profound fears of medical care or blood may get worse. Especially vulnerable are people with hypochondriasis or hypochondria, which is now called somatic symptom disorder or illness anxiety disorder. Since COVID-19, symptoms are so non-specific and tests are often unavailable or unreliable that can feed to people's illness. Obsessive compulsive disorder can get worse with some validation of distressing symptoms like excessive hand washing. And as mentioned before, there are numerous reports of domestic violence increase due to pandemic and increased rates of child abuse with heightened stress and schools being closed. And naturally, substance use disorders, including alcoholism, affect people's mental health and functioning. Thank you.
Thank you. Doctor, is it known if COVID-19 causes any psychiatric symptoms?
There might be some psychiatric conditions directly related to COVID, which is a more biological pathway to psychiatric syndromes. Acute syndromes might include delirium, confusion, and symptoms can be related to acute stroke by the vascular manifestation of the infection. Later psychiatric symptoms may be a result of immunologic responses to the infection, and perhaps from the ongoing presence of the virus in the central nervous system. There is much more to learn about this virus and the extent to which CNS may serve as a reservoir for the infection, like it does for HIV, or maybe some long-term sequelae like with bacterial Lyme disease. So more symptoms might emerge months to years after the initial infection, but it's yet to be learned.
Yes. Using therapy, how would you help people who are experiencing the effects of our current environment?
Therapy is important. Psychological first aid is a standard intervention that is recommended by a World Health Organization, and for most individuals following a disaster. It's validated and evidence-informed. It fosters self-efficacy and hope, and is intended to relieve some stress and de-stress by creating an environment that's safe, calm, and connected. While psychological first aid is a form of rather universal precaution and prevention, it's not designed for people with severe mental illness and not a formal psychiatric intervention done by clinicians. Its principles, however, can easily be applied to patients with severe mental illness to prevent distressing symptoms from becoming a relapse. An individual therapy supportive approach may be the most important tool that we have to help patients with loss and uncertainty. We need to clarify, as mentioned before, that social distancing refers to physical distancing and not emotional isolation. There is a long old saying that all psychopathology is loss and all psychotherapy is mourning. Though it's oversimplified, it's still quite useful. We need to understand the impacts of loss in three different categories: the bereavement, grief, and mourning. COVID-19 caused all kinds of loss. To reiterate, it's deaths occurring in large numbers, families being unable to say goodbye to loved ones, widespread economic loss, loss of housing, access to important peer relationships, personal freedoms with increased isolation and loneliness related to sheltering in place, virtually or socially distant masked relationships substituting for authentic human closeness, interrupted education, lack of access to rituals like graduations and weddings and holiday gatherings, uncertain outlook for the future. So in therapy, careful attention shall be paid to patients' narratives that often reveals that though they have grieved, they have not fully mourned. The grief is a normal reaction to the loss, and mourning is the active process by which people adapt to that loss. Psychotherapy can offer that interpersonal opportunity and create the safe relationship in which to carefully approach the pain of loss and to share the burden to unblock the mourning process. And sometimes the concrete help and problem solving, like case management and filling out the forms, can be the example of proactive crisis intervention, which is not a formal therapy, but as or more important. Martha?
At what point would you find that a patient may benefit from medication in addition to the talk therapy and physical care?
We diagnose and treat mental illness as usual, as indicated, but we keep in mind the larger context of external environmental stress of the pandemic. So while prescription might not change that external stress, it might lift up the mood and take the edge of anxiety just enough so the patient might effectively engage in psychotherapy. So judicious and temporary use of anxiolytic medications might be appropriate to reduce anxiety. And medication here is seen as a foundation to build up upon with therapy and relationships.
Doctor, we've been talking about how difficult the current situation is for many people. So I'm wondering, though paradoxically, are there people whose mental health benefits from the current situation or simply remains unaffected?
Interestingly, yes, we might have some hobbies and interests that we've neglected for a long time, and now we can fall back on. People engage in activities such as gardening and cooking, reading, listening to music, streaming TV even, which might be more available to us now. Many of our patients with chronic mental illness may be functioning reasonably well, may be reaping the rewards of years of coping skills and consistent support from strong mental health programs. But another reason might be lower expectations. Some of my stable patients with schizophrenia say, no one is hassling me now, no one is aggravating me to go to groups and volunteer and search for a job. Some people just feel more relaxed. Some people who suffer from social anxiety disorder actually do better with less exposure. And certainly the Freudian Schadenfreude defense, the pleasure derived from other people's misfortune, either aggression, rivalry, or justice-based, might have something to do with this. Some patients say, well, welcome to my world, now you can relate, because years of hardships and social anxiety and psychosis and OCD have trained and inured some people to daily pain and constriction and misery of social isolation. Marta?
Interesting. When should people reach out and seek mental health assistance to deal with the effects of this pandemic, either from the illness itself or from the preventative behaviors being asked of us, quarantining, physical distancing, wearing masks, etc.?
It's important to seek professional help when that feeling of intolerable distress happens. Feeling hopeless and helpless, seeing no light at the end of the tunnel, notable irritability or aggression, increased substance use that is really off the baseline, loss of sleep, severe pervasive anxiety, disabling anhedonia, that inability to feel pleasure. All those things would justify professional assessment, and of course suicidal ideation. When suicide becomes an option, it's time to reach out and get help. Marta?
Dr. Epstein, thank you. Thank you so much for your insight into this. Thank you to all of our panelists for their unique perspectives. We have a few minutes and we have received a few questions that I'd like to talk to our presenters and kind of get their feedback on. I'd like to start with Dr. Quinn, if I may. Dr. Quinn, for those with pre-existing conditions that have been linked to increased rates of hospitalization with COVID, such as the asthma, high blood pressure, obesity as an example, are there any additional precautions they should be taking, or should they be concerned about any medications that make them more vulnerable?
Yeah, no, that's a great question. What we know about COVID, obviously, as everyone said, we're still learning. And so the biggest risk factors when you look at, hospitalizations and death in people with COVID really are hypertension, obesity, diabetes, chronic lung disease, but interesting enough, asthma is not one of the top ones, which I thought was very interesting. The precautions for people to take are really the same precautions that we all need to be taking now. And I think also making sure you're trying to keep your chronic medical conditions under as best control as you can, getting the flu shot, wearing masks. In the beginning of COVID, there was a lot of sort of talk about, certain medications made it worse. There's a while that people were told not to take ibuprofen. There are certain blood pressure medicines that were told that made it worse. And all of that right now has not panned out. Things that do make a difference in terms of medications are chronic medications that immunosuppress people. So there's people with autoimmune diseases who are on immunosuppressants. There are people who are undergoing cancer treatments who are on immunosuppressants. And those people tend to have obviously a higher risk of getting illness in general. I think one of the things that this virus has shown, though, that I think is something that we're all going to have to grapple with is the significant disparity in outcomes based on race. You know, we are seeing that Black Americans and Hispanics are, when they get this virus, are dying at significantly higher rates than anyone else. And I think those communities are people that we really need to keep an eye on and try to help them stay as safe as we can.
Thank you. Thank you, Dr. Quinn. Jody, if I may, if someone has a friend or a family member who's struggling to keep themselves mentally well in the past, and they're starting to see some behaviors that raise concerns, what's the best way to approach that person to show concern and let them know that there's help available?
So I think that there is a technique that we all like to use, an intervention that's called motivational interviewing. And it's really leading that person to see the changes in themselves as much as you can. It's talking to them in a way where they can come to some of those conclusions without you having to tell them. But also it's just continuing to provide whatever level of support. If you know or love someone who's dealing with severe mental health, it's good to know who their treatment providers are, who are their connections in the community. And maybe if you have their permission to be able to reach out and just let those people know that they might need more psychiatric support or support with social determinants of health. I think that's really kind of the best way. And of course, knowing the person and knowing what they look like when they're well and happy and what they look like when their symptoms have kicked up.
Thanks, Jody. Great information. Dr. Epstein, if someone is thinking about going on a medication to help them at this time, are there questions they should ask their psychiatrist, their physician, to make sure that they're getting on the right type of medicine, especially if they think they may only need it short term?
Good question. Yes, as with any psychiatric evaluation, it's important to clearly communicate the goals and the expectations for the treatment. It's very helpful for us to have the list of all the medications, not just psychiatric, to be able to assess potential drug-drug interactions, to learn about the past trials, what worked and what didn't, and have additional relevant data like recent lab work that will help us to find the proper medication that might be better tolerated and more effective. Having Hixny consent signed helps us in a major way to be able to get much of that collateral information. But those are the general things we would be looking for.
Excellent. Thank you, Doctor. I think we have time for one more question. Dr. Quinn, if I may, you have experienced most, if not all, of your career in a rural setting. Are you seeing any difference in behaviors or attitudes about the pandemic in these smaller communities than what we're seeing in a more populated area? As an example, are you finding, because it's a smaller community, a more close-knit group, people are taking precautions more seriously because they don't want someone they know to get sick? Or is there something to be learned from these communities about how we approach the current situation?
Yeah, so, you know, this is a hard question because obviously I only know the world I live in. It's interesting. I think that it goes both ways, and I think it probably goes both ways anywhere. There are certain people who are doing very well with taking precautions because of what you just said in terms of being very close to their families and to their community. But we also live in a rural area, and so the opposite is true. So people feel that, you know, we haven't seen a huge COVID spike here, and so there's some semblance of, you know, we're pretty protected. We live far away from one another. We're not in as much of close proximity. The density of population is less. And so there's some people who feel that it's not real, that it's not going to affect them. So I think the biggest thing that we can do is continue to educate. I think if you look at the Midwest right now and how everything is blowing up in rural communities, I'm nervous that, you know, some of the behaviors that we're seeing, that because we have this sense of not being affected expected are going to hit us here as well. So it's just, I don't know if I can answer that definitively, but I think that it's very person dependent, and I think we have continued a lot of education to do.
Thank you very much, Dr. Quinn. Thank you again to all of our panelists. Our time is up. The information and perspective that each of you have shared is very important and helpful for all of us at work and at home. Thank you to our audience for spending this hour with us. Please look for a follow-up email from us, which will include a brief survey. We would appreciate you filling that out. And as always, Hixny is where healthcare comes together. Thank you and stay well.